The ACL is the central ligament within the knee, which helps prevent the knee from shifting on itself. Sustaining an ACL tear typically causes a significant amount of strain and damage to the knee that can actually result in future episodes of instability. These episodes can actually cause a lot of damage in and around the knee, such as a meniscus tear. Unfortunately, the damage that's done when the knee pivots on itself to the hard cartilage as well as the meniscus is irreversible. And this irreversible damage is the reason the risk of arthritis is so high after an ACL injury within the first 15 years. And this is with or without surgery. We won't change the risk of arthritis with having surgery. The goal of this surgery is to regain stability of the knee and prevent any further instability episodes, which hopefully will help protect that hard and soft cartilage. While waiting for surgery, the very best thing you can do is strengthen the knee. Through a program of prescribed stretches and exercises, you'll already be ahead of the game before even undergoing the procedure. The surgery itself is performed on an outpatient basis, meaning you come and go from the hospital on the same day. The ACL itself is recreated using a graft taken from the same injured knee. And here at Kelowna Bone and Joint, the most common tendon we use is one of the hamstring tendons. The remainder of the surgery is done arthroscopically, meaning using small poke hole incisions to accommodate the camera, the instruments, and the passage of the graft through the knee. Heading into surgery, you do have to understand that this procedure does not restore the knee to its original state. A successful ACL surgery creates a pain-free and stable knee that functions well for the needs of the individual, whether it be sports, work, or even activities of daily living. Success depends largely on post-operative rehabilitation, strengthening, and with the right program, full use of the knee can be expected between 6 and 10 months after the operation. Like any surgery, there's always a risk of potential complication, some of which could require a reoperation. Anytime we perform surgery, there's a potential risk of infection. We decrease this risk by giving you antibiotics right before the procedure, but it never brings that risk back down to zero. Post-operatively, there's a risk of excessive knee stiffness and the inability to regain full motion, but this can be reduced by post-operative exercises. Despite having a brand new ACL, it can stretch, especially if it's not protected well initially, leading to potential graft failure and ongoing instability. In addition, there's always the chance you re-tear your ACL from a repeat injury. There are general risks to consider as well, including those related to the use of the anesthetic, bleeding, and the development of blood clots. ACL reconstruction, though, has a very good success rate at regaining stability in the knee and can have a huge impact to the quality of life and function. To see a detailed video about the surgery, including a recreation of the procedure using models, click on the link below, and please don't hesitate to discuss any questions you may have with your surgeon or your care team. Thanks so much for watching.